Questions 1 to 12. You hear a gastroenterologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Ms. Mihiraa. Please have a seat.
Good morning, doctor. Thank you.
You're welcome. Now, I understand you've been referred by Dr. Paul.
Yes, doctor. I've been experiencing intermittent abdominal pain for the past 6 months.
I'm sorry to hear that. Can you tell me a bit about what's been troubling you? I see. Can you describe the character of your stools in more detail? Are they oily or greasy?
No, not oily, but they do tend to float.
And the pain, is it aggravated by specific foods or activities?
It seems to worsen after meals, especially those high in fat. I've also noticed it's more pronounced after consuming dairy products.
Mihiraa, have you experienced any other gastrointestinal symptoms, such as heartburn, nausea, or vomiting?
I experience occasional heartburn, which is usually mild. I haven't experienced vomiting, but I have felt nauseated on several occasions.
Let's delve into your medical history. Have you had any previous gastrointestinal issues, surgeries, or inflammatory bowel diseases?
I had a cholecystectomy 5 years ago. Other than that, no significant gastrointestinal history. I had a cholecystectomy 5 years ago. Other than that, no significant gastrointestinal history.
And Mihiraa, your family history? Any instances of inflammatory bowel disease, celiac disease, or other digestive disorders?
My mother has type 1 diabetes, and my uncle has irritable bowel syndrome.
I see. Now, can you tell me about your diet and lifestyle? Any recent dietary changes, stress, or travel?
I've been trying to eat healthier, so I've increased my fiber intake. No significant stress or travel.
And your medications? Are you taking any over-the-counter or prescription drugs, Mihiraa?
I'm on a low-dose aspirin for my cholesterol, and I occasionally take ibuprofen for headaches.
Based on your symptoms, I suspect you may be experiencing malabsorption issues. To confirm this, we'll need to perform some tests.
What kind of tests?
We'll start with blood tests to check for anemia, inflammatory markers, and celiac disease antibodies. I'll also request a stool sample for further analysis. If indicated, we may proceed with an endoscopy and colonoscopy.
Okay, doctor.
In the meantime, I recommend following a low-fat diet and avoiding dairy products until we have more information.
That's it.
I'll prescribe loperamide to help manage your diarrhea.
Thank you, doctor.
You're welcome, Mihiraa. I'll call you as soon as the test results are available.
Questions 13 to 24. You hear a dentist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please have a seat.
Good morning, Dr. Ways.
So, what brings you in today?
I've been having a terrible toothache that has been causing me a great deal of discomfort. I
see. Can you describe the pain for me?
It's a throbbing pain, mostly. It's been getting worse over the past few days. And it's sensitive to hot and cold drinks. Additionally, I've noticed some swelling around the tooth and a small amount of bleeding whenever I brush.
I see. When did this start?
About 15 days ago. It was while I was having chicken roast. I felt a sharp pain, and it's been bothering me ever since.
Have you taken anything for the pain, Mihiraa?
Yes, I've been applying a topical gel called benzoylamine hydrochloride directly to the painful area to numb it. I've also been taking ibuprofen, a common over-the-counter pain reliever, but it hasn't provided much relief from the discomfort.
Let's take a look. Open wide, please. Mihiraa, based on my examination, it appears you have a cavity in your upper right second molar. This tooth is showing signs of inflammation, which suggests there's a minor infection present as well.
Oh no, a cavity.
There's no need to worry. We can fix this. The treatment plan involves removing the decayed portion of the tooth and filling the cavity. Apart from that, I will prescribe medication, which will help combat the infection and reduce the swelling and discomfort.
How does it work?
Okay, Mihiraa, let's discuss the procedure. First, I'll administer a local anesthetic to numb the area around the tooth. This might feel like a small pinch, but it will ensure you don't experience any pain during the treatment. Once the area is numb, I'll use a dental drill to remove the decayed portion of the tooth. You might hear a slight humming sound, but you won't feel any discomfort. After cleaning the area, I'll apply a bonding agent to help the filling adhere to your tooth. Then, I'll fill the cavity with a composite filling material, which is tooth-colored. Finally, I'll shape and polish the filling to match the rest of your tooth.
How long does it usually take?
The entire procedure, including the numbing, usually takes about an hour. Afterward, you might experience some sensitivity to hot and cold drinks, but this should subside within a few days. It's important to avoid biting down hard on the filled tooth for the next 24 hours to allow the filling to set properly. To address the inflammation and infection, I'll prescribe amoxicillin, an antibiotic.
Will the filling fix everything?
That's a good question, Mihiraa. Normally, the filling will take care of the cavity, but we might need to do a root canal treatment if the infection has reached the pulp. We'll see after we clean out the cavity.
What are the other options?
If the damage to the tooth is too extensive to be repaired, we may need to consider extracting it. However, let's see how the initial treatment progresses before making that decision.
Okay, doctor.
In addition to taking the prescribed medication, it's crucial to maintain excellent oral hygiene. Mihiraa, be sure to brush your teeth twice a day using fluoride toothpaste. Floss regularly to clean between your teeth, and use an antiseptic mouthwash to kill bacteria. To avoid putting extra pressure on the affected tooth, it's best to stay away from hard foods.
I will, doctor. Thank you.
You're welcome. I'll schedule a follow-up appointment in a week. Let's hope the treatment works well.
That is the end of Part A. Now look at Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a pharmacist talking to a patient called Mihiraa. Now read the question.
Mihiraa, choosing the right sunscreen can be overwhelming. Let's break it down. The most crucial factor is the SPF, or sun protection factor. This number indicates how long the sunscreen protects you from UVB rays, which cause sunburn. However, remember, no sunscreen offers complete protection.
So, a higher SPF is always better, right?
Not necessarily. While a higher SPF might sound more appealing, the difference in protection between SPF 30 and SPF 50 is minimal. It's more important to reapply sunscreen every 2 hours, especially after swimming or sweating.
I see. What about UVA rays? Don't they cause skin damage too?
Absolutely. UVA rays penetrate deeper into the skin and contribute to premature aging and wrinkles. Look for broad-spectrum sunscreen, which protects against both UVA and UVB rays. Additionally, consider wearing protective clothing and seeking shade during peak sun hours.
Now look at question 26. You hear a nursing manager talking to a nurse called Mihiraa. Now read the question.
Mihiraa, we need to closely monitor patient 452, Mr. Paul. He's at high risk for seizures due to his recent brain surgery. His sodium levels are slightly low, and he's been experiencing some fluctuations in blood pressure, both of which can trigger seizures.
I understand, Nino. I've already implemented seizure precautions. I've raised the bed rails, patted the side rails, and made sure suction equipment is readily available.
Good, but we need to be proactive. Educate his family about seizure first aid and the importance of calling for help immediately. Also, keep a close eye on his oxygen saturation levels. Sudden drops can precede a seizure. And Mihiraa, administer anti-seizure medication as ordered, but be prepared to assist with intubation if necessary.
I'll make sure the respiratory therapist is aware of the situation. We'll be ready for any eventuality.
Excellent. Remember, early intervention is crucial. Any signs of seizure activity, no matter how subtle, should be reported immediately.
Now look at question 27. You hear a nurse talking to a junior nurse called Mihiraa. Now read the question.
Mihiraa, I want to emphasize the importance of proper infusion. It's a delicate procedure with potential complications. Always verify the doctor's order, patient identity, and medication before starting.
Of course, Mario. I double-check everything.
Good. But it's not just about the initial setup. Monitor the infusion site closely for signs of infiltration or phlebitis. If the site looks red, swollen, or painful, stop the infusion immediately. Also, watch for fluid overload. Mihiraa, if the patient complains of shortness of breath, increased heart rate, or edema, slow down or stop the infusion and notify the doctor.
I'll keep an eye on those symptoms.
And remember, medication incompatibilities can be dangerous. Always check the drug handbook before mixing medications in the same 4-bag. Incompatibility can lead to precipitation or inactivation of the drugs.
Now look at question 28. You hear a nurse talking to a doctor called Mihiraa. Now read the question.
Dr. Mihiraa, I'm calling about patient 321, Mr. Peter. He had a fall last night. He slipped and fell while trying to get to the bathroom. He complained of pain in his right hip.
How is he doing now? Any signs of head injury?
He's conscious and alert, but complaining of increasing pain in his hip. I've already applied ice packs and elevated the leg. No visible signs of head injury, but I've monitored him closely. Vital signs are stable. The indication of increased risk of infection due to the injury is nil.
Good. Order an X-ray of the hip immediately. I suspect a possible fracture. Meanwhile, administer pain medication as needed. We'll assess the need for further imaging once we have the X-ray results.
Will do, Dr. Mihiraa. I'll also assess his mobility and see if he needs assistance with daily activities.
That's important. Falls can lead to decreased mobility and increased risk of another fall. Implement fall prevention measures like bed alarms and non-slip socks. Now look at question 29. You hear a nursing manager, Mihiraa, talking to nurses during a meeting. Now read the question. Nurses, I have some important updates regarding new hospital policies. First, we're implementing stricter hand hygiene guidelines. All staff, including visitors, must use alcohol-based hand rub upon entering and exiting patient rooms. This is to reduce the spread of infections.
Will this increase our workload, Mihiraa?
Initially, yes, but it's crucial for patient safety. We'll provide additional hand sanitizer dispensers for convenience. Second, we're revising our documentation procedures. All patient assessments and interventions must be documented electronically within 15 minutes of completion. This will improve efficiency and accuracy.
What about nurses who work in high-stress areas? Mihiraa, will there be flexibility?
We understand the challenges. However, timely documentation is non-negotiable. We're exploring options like voice-to-text technology to streamline the process. Lastly, we're introducing mandatory annual training on patient safety and fall prevention. This includes education on proper patient positioning, use of assistive devices, and early identification of fall risks. Now look at question 30. You hear a nursing manager called Mihiraa talking to nurses. Now read the question. Good morning, team. I want to address the patient fall incident that occurred yesterday in Ward B. Mr. Peter, room 302, unfortunately, slipped and fell while attempting to use the restroom. He sustained minor injuries, but this incident highlights the importance of patient safety.
Was it due to understaffing? We've been shorthanded lately, Mihiraa.
Staffing levels are a concern, but the primary factor seems to be a missed opportunity for intervention. Mr. Peters' call bell was not answered promptly. This emphasizes the need for timely response to patient calls. We need to improve our response times.
Mihiraa, should we consider using bed alarms for all patients?
Bed alarms are one tool, but they're not foolproof. Regular patient assessment and proactive fall prevention measures are essential. We'll review each patient's fall risk and implement appropriate interventions. That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between Dr. Mihiraa and an interviewer.
Good morning, Dr. Mihiraa. Thank you for joining us today. To begin, Could you explain what is meant by multidisciplinary team collaboration?
Good morning, and thank you for having me. Multidisciplinary team collaboration refers to a coordinated effort among professionals from different specialties or disciplines working together to achieve a common goal, often centered on patient care. This type of collaboration is not just about having different professionals involved. It is about creating a synergistic environment where each professional's unique expertise contributes to a holistic approach to patient care. It involves shared decision-making, open communication, and mutual respect among team members. The focus is on leveraging the diverse perspectives and skills of the team to enhance the quality of care, address complex patient needs comprehensively, and ultimately improve patient outcomes. For example, in managing a patient with chronic conditions like diabetes and heart disease, a team might include a general practitioner, a cardiologist, a nutritionist, a nurse, and perhaps a social worker. Each team member brings their specific expertise, but the power of multidisciplinary collaboration lies in how these professionals integrate their knowledge to develop and implement a patient-centered care plan that addresses all aspects of the patient's health.
That sounds incredibly important. Could you delve into why multidisciplinary team collaboration is so crucial, especially in today's healthcare environment?
Absolutely. The importance of multidisciplinary team collaboration in healthcare cannot be overstated. As our understanding of diseases and their treatments becomes more sophisticated, the need for diverse expertise grows. Multidisciplinary collaboration ensures that all aspects of a patient's health are considered, reducing the risk of oversights that could occur if care were siloed within a single discipline. For instance, the intersectionality of mental and physical health is a prime example. A patient with chronic pain may also be suffering from depression, and the treatment plan should address both the physical symptoms and the psychological aspects. By bringing together professionals from different fields, multidisciplinary teams can create more comprehensive and tailored treatment plans, thereby improving patient outcomes. Additionally, this collaboration fosters innovation as different perspectives and problem-solving approaches are shared. It also enhances patient safety as multiple professionals review and contribute to the care plan, which reduces the likelihood of errors. Moreover, in an era where healthcare costs are a significant concern, multidisciplinary collaboration can lead to more efficient use of resources by reducing duplication of tests and procedures, ultimately improving the cost-effectiveness of care.
Given its importance, Dr. Mihiraa, what is the current status of multidisciplinary team collaboration in healthcare settings?
The current status of multidisciplinary team collaboration varies significantly depending on the healthcare setting and geographic location. In many advanced healthcare systems, multidisciplinary collaboration is increasingly becoming the norm, particularly in specialized fields such as oncology, where multidisciplinary tumor boards regularly meet to discuss complex cases. These systems often have the infrastructure, resources, and culture that support effective team collaboration. However, there are still challenges, particularly in less resource-rich environments where such collaboration may be more fragmented or ad hoc. There may be systemic barriers such as rigid hierarchical structures, lack of time, or inadequate communication tools that hinder effective collaboration. Furthermore, the integration of multidisciplinary teams into everyday practice is often inconsistent. Some healthcare professionals may not fully understand or embrace the concept of collaborative care, leading to varying levels of participation and effectiveness within teams. Additionally, in some settings, there's a lack of formal training or guidelines on how to effectively collaborate across disciplines, which can result in suboptimal teamwork. While there has been progress, there's still a significant gap between the ideal of seamless multidisciplinary collaboration and the reality on the ground, especially in primary care settings where resources are often stretched thin.
It seems like there's room for improvement. Dr. Mihiraa, what steps can be taken to strengthen multidisciplinary team collaboration in healthcare?
Strengthening multidisciplinary team collaboration requires a multifaceted approach that addresses both systemic and interpersonal factors. First, creating a supportive organizational culture that values and promotes teamwork is essential. This can be achieved by fostering an environment where open communication, mutual respect, and shared goals are prioritized. Regular team meetings, joint training sessions, and interprofessional education can help build trust and understanding among team members, ensuring that each professional appreciates the value of others' contributions. Additionally, implementing standardized protocols for communication and decision-making within teams can reduce misunderstandings and ensure that all voices are heard. Technology also plays a crucial role in facilitating collaboration. Tools such as electronic health records, EHRs, that are accessible to all team members can ensure that everyone is on the same page regarding a patient's care plan. Moreover, leadership plays a critical role in fostering effective collaboration. Leaders who model collaborative behavior, provide the necessary resources, and remove barriers to teamwork can significantly enhance the effectiveness of multidisciplinary teams. Finally, continuous evaluation and feedback are vital. Teams should regularly reflect on their collaboration processes and outcomes, identifying areas for improvement and making adjustments as needed. By addressing these areas, healthcare organizations can create a more cohesive and effective multidisciplinary approach that ultimately benefits patients.
Dr. Mihiraa, you mentioned evaluation and feedback. How can we measure the effectiveness of multidisciplinary team collaboration?
Measuring the effectiveness of multidisciplinary team collaboration can be challenging, but it's essential for continuous improvement. Several methods can be used to assess collaboration within teams. One approach is to measure patient outcomes, such as the quality of care delivered, patient satisfaction, and health improvements, which can serve as indirect indicators of effective teamwork. For instance, if a multidisciplinary team is managing a diabetic patient's care, metrics such as blood sugar control, complication rates, and patient adherence to treatment plans can provide insights into how well the team is collaborating. Another method is the use of structured assessments or surveys that capture the perceptions of team members regarding the quality of collaboration. These assessments can evaluate aspects such as communication effectiveness, role clarity, mutual respect, and the overall functioning of the team. In some settings, observational studies or audits can be conducted where an external evaluator assesses team interactions during meetings or rounds, providing objective feedback on the collaboration dynamics. Additionally, team performance metrics, such as the timeliness and appropriateness of interventions, can be analyzed. A combination of these methods, rather than relying on a single measure, is often the best approach to gaining a comprehensive understanding of how well a multidisciplinary team is functioning. It's important to recognize that these measures should be used not only for evaluation, but also as a basis for ongoing professional development and team-building activities.
That makes a lot of sense. Finally, Dr. Mihiraa, what could happen if multidisciplinary team collaboration is absent in healthcare settings?
The absence of multidisciplinary team collaboration can have serious consequences for both patient care and the healthcare system as a whole. Without collaboration, patient care can become fragmented, with each professional focusing solely on their area of expertise without considering the broader context of the patient's health. This can lead to incomplete or contradictory treatment plans, where critical aspects of a patient's condition may be overlooked or not adequately addressed. For example, in the case of a patient with both heart disease and depression, a cardiologist might focus on managing the heart condition without addressing the psychological aspects, leading to poorer overall outcomes. Moreover, the lack of collaboration can increase the likelihood of medical errors, as there is no comprehensive view of the patient's care plan that integrates inputs from all relevant disciplines. It can also lead to inefficiencies, with duplicated tests, conflicting treatments, and unnecessary procedures, all of which contribute to higher healthcare costs and potential harm to the patient. From a systemic perspective, the absence of collaboration can create a siloed culture within healthcare organizations where professionals work in isolation, leading to a lack of shared learning, innovation, and professional development. This can diminish job satisfaction among healthcare providers, as working in silos often leads to increased stress, burnout, and a sense of professional isolation. Ultimately, the absence of multidisciplinary collaboration undermines the quality, safety, and efficiency of patient care, highlighting the critical need to foster and sustain collaborative practices in healthcare settings.
Now look at Extract 2, questions 37 to 42. You hear an oncologist talking about the research conducted at the Mihiraa Research Center. You now have 90 seconds to read questions 37 to 42.
Good day, esteemed colleagues and distinguished guests. It is both an honor and a privilege to speak to you today about the remarkable strides made in the field of oncology at the Mihiraa Research Center. As many of you are aware, our field is one of relentless challenges and boundless opportunities. The battle against cancer is one that continues to inspire the brightest minds to push the boundaries of science and medicine. Today, I will delve into the latest advancements that have emerged from our research center, exploring not just what they are, but also their profound impact, the metrics we use to gauge their progress, the methodologies of their implementation, their potential future scope, and the critical question of their reliability. The Mihiraa Research Center has been at the forefront of oncological research, and our most recent advancement is a novel multi-targeted immunotherapy that leverages the intricacies of the patient's immune system to target and eliminate cancer cells more effectively. Unlike traditional therapies that primarily focus on a single pathway or target, our approach involves a complex network of immune checkpoints and tumor antigens. This method is designed to activate a more robust and sustained immune response, utilizing a combination of personalized vaccines, checkpoint inhibitors, and adaptive cell transfer therapies. Our innovation at Mihiraa Research Center does not merely lie in the combination of these therapies, but in the sophisticated algorithm developed by our bioinformatics team, which identifies the most potent antigens unique to each patient's tumor profile. By integrating next-generation sequencing, NGS, with machine learning algorithms, we have created a personalized immunotherapy plan that is both dynamic and adaptable as the tumor evolves. This personalized approach has the potential to overcome the challenges posed by tumor heterogeneity and immune escape, making it a game-changer in the treatment of various cancers, particularly those that are resistant to conventional therapies. The impact of this multi-targeted immunotherapy is multifaceted. Firstly, it has shown a significant improvement in overall survival rates in patients with advanced stage cancers, particularly in melanoma, non-small cell lung cancer, and triple-negative breast cancer. The therapy has demonstrated not only the capacity to shrink tumors, but also, in some cases, to induce complete remission. This is a significant departure from the modest improvements seen with existing treatments, underscoring the potential of our approach to redefining the standard of care. Additionally, the therapy's ability to reduce the likelihood of recurrence is another critical aspect of its impact. By training the immune system to recognize and combat cancer cells even after the initial treatment, we are observing longer-lasting responses, which translates into improved quality of life for patients. Furthermore, this therapy is characterized by a favorable safety profile compared to traditional treatments like chemotherapy and radiation, which are notorious for their severe side effects. Patients undergoing our immunotherapy experience fewer adverse reactions, making it not only more effective but also more tolerable. On a broader scale, the development of this therapy represents a pivotal shift towards precision medicine in oncology. By tailoring treatment to the individual patient's tumor characteristics, we are moving away from the one-size-fits-all approach, which has often led to suboptimal outcomes. The success of our research is likely to inspire further exploration into personalized cancer therapies, potentially influencing clinical practices worldwide. Measuring the progress of this immunotherapy necessitates a combination of traditional and innovative metrics. Clinically, we continue to monitor standard endpoints such as overall survival, OS, progression-free survival, PFS, and response rates, RR. However, given the unique nature of immunotherapy, additional measures are essential to capture its full impact. One such measure is the Immune-Related Response Criteria, IRRC, which accounts for the different patterns of tumor response observed with immunotherapies. Unlike conventional criteria, which may prematurely categorize a patient as non-responsive due to an initial increase in tumor size, a phenomenon known as pseudoprogression, IRRC allows for a more accurate assessment of true therapeutic benefits. Another critical metric is the analysis of immune biomarkers. By measuring changes in immune cell populations, cytokine levels, and tumor mutational burden, TMB, we gain insights into the biological mechanisms driving the response or resistance to therapy. These biomarkers not only serve as indicators of efficacy, but also help in refining the treatment strategy for individual patients, ensuring that the therapy remains aligned with the evolving nature of the tumor. In addition to these clinical and biological measures, patient-reported outcomes, PROs, are an essential component of our progress assessment. Given the emphasis on quality of life in modern oncology, understanding how patients perceive their treatment and its impact on their daily lives is crucial. At Mihiraa Research Center, PROs provide a comprehensive view of the therapy's benefits beyond what can be captured by clinical measures alone. Implementing this multi-targeted immunotherapy in clinical practice involves several key steps, each requiring meticulous planning and execution. The process begins with the comprehensive genomic and proteomic profiling of the patient's tumor. This data is then fed into our proprietary algorithm, which identifies the optimal targets for the therapy. The next step involves the manufacturing of personalized vaccines and the preparation of immune cells for transfer, which are tailored to the individual patient's needs. Given the complexity of this process, the implementation is currently confined to specialized centers with the necessary infrastructure and expertise. Training of clinical personnel is another critical component, ensuring that oncologists and support staff are well-versed in the nuances of this therapy. This includes not only the technical aspects of administering the treatment, but also the management of potential side effects, which, while generally mild, can still pose challenges. Collaboration with regulatory bodies is also a key aspect of implementation. Given the novel nature of this therapy, ongoing dialogue with agencies like the FDA is essential to ensure that the treatment meets all safety and efficacy standards. We have been actively involved in Phase 3 clinical trials, which are designed not only to confirm the benefits observed in earlier studies, but also to establish the therapy's role in the broader landscape of cancer treatment. Moreover, patient selection criteria are critical for successful implementation. Not all patients will benefit equally from this therapy, and identifying those who are most likely to respond is essential. This involves a careful evaluation of the tumor's genetic and immunologic profile, as well as the patient's overall health and comorbidities. By refining these criteria, we aim to maximize the therapy's benefits while minimizing the risk of adverse outcomes. The future scope of this multi-targeted immunotherapy is expansive. One of the most promising avenues of exploration is the combination of our therapy with other emerging treatments, such as oncolytic viruses and cancer vaccines. These combinations have the potential to enhance the immune response even further, targeting cancer cells through multiple mechanisms and reducing the likelihood of resistance. Another area of focus is the application of our therapy to a broader range of cancers. While our initial studies have focused on specific malignancies, the underlying principles of this therapy could be adapted to treat a wide variety of solid tumors and hematologic cancers. This would involve further refinement of our algorithms and an expansion of our clinical trials to include a more diverse patient population. In addition, at Mihiraa Research Center, we are exploring the potential of our therapy to be used in earlier stages of cancer, including as a neoadjuvant treatment before surgery or as an adjuvant therapy to prevent recurrence. The idea is to leverage the immune system's power at the earliest possible stage, potentially eradicating the disease before it can establish a strong foothold. Another exciting prospect is the integration of artificial intelligence, AI, and machine learning into our algorithms, further enhancing their ability to predict treatment responses and adapt to changes in the tumor. This could lead to even more personalized and effective therapies, as well as shorter timelines for treatment planning and implementation. The reliability of our multi-targeted immunotherapy is a critical consideration, particularly as we seek to move from experimental to standard clinical practice. Several factors contribute to this reliability, including the robustness of our bioinformatics algorithms, the consistency of our manufacturing processes, and the reproducibility of clinical outcomes. Our algorithms have been rigorously tested and validated across multiple datasets, ensuring that they can accurately predict the most effective targets for each patient. Moreover, our manufacturing processes adhere to the highest standards of quality control, minimizing the risk of variability in the personalized vaccines and immune cells produced. Clinical reliability is further supported by the consistency of our results across different patient populations and tumor types. The therapy's efficacy has been demonstrated in a variety of settings, from small-scale early-phase trials to large multi-center studies, providing a strong foundation for its broader application. However, it is important to acknowledge that reliability in oncology is not just about achieving consistent results, but also about managing uncertainty. Cancer is a highly complex and evolving disease, and even the most advanced therapies may not work for every patient. This underscores the importance of ongoing research, continuous refinement of our techniques, and the development of predictive biomarkers that can help identify those patients who are most likely to benefit from our therapy. In conclusion, the advancements at Mihiraa Research Center represent a significant leap forward in the field of oncology. Our multi-targeted immunotherapy, with its personalized approach, has the potential to transform cancer treatment, offering new hope to patients who have exhausted other options. However, as with any new therapy, its success will depend on careful implementation, ongoing evaluation, and a commitment to further innovation. I thank you for your attention and look forward to the discussions that will follow.